Good day everyone, I am Kyle Abigail COMONAL, and for today I am going to perform and show you my open gloving return demonstration. Gloves create a barrier between germs and the hands. So wearing gloves helps protect both patients and healthcare workers from infection. And in the hospitals, it helps prevent the spread of germs from one person to another. And it helps keep our hands clean and lessen our chance of getting germs that can make us sick. And wearing gloves also reduce the risk of contamination of healthcare workers' hands with blood and other body fluids. And it also reduces the risk of germ dissemination to the environment and of transmission of germs or microorganisms from healthcare worker to the patient and vice versa, as well as from one patient to another. Prior to the conduct of the procedure, I have performed thorough hand washing. We must remember that sterile gloving or the use of sterile gloves does not replace hand washing. So our hands must be washed, or we must perform hand hygiene and hand washing before and after any procedure. Okay, I already have here, or I have prepared these sterile gloves that I will be using. Ensure that the gloves are of the right size. It is important to choose the right size of gloves for our hands because gloves come in multiple sizes. So making sure that the gloves are tight enough or it fits well in our hands to ensure users' comfort in picking up objects. And it also avoids contamination, as if the gloves are too big, then it would be difficult for us to hold or pick up objects, and it would be easier for germs to get inside the gloves. And if the gloves are too small, then it is most likely to get ripped. And if not, it may cause decrease in blood flow to the fingertips that may result to pain, numbness, and constraints in fingers and hand movements. Okay, inspect for any tear and stains in the packaging. Okay, there is none. And now that we have confirmed that, then we are good to go to the next procedure, which to remove the outer wrapper of the glove package. In doing so, we're gonna separate or peel off the sides. Okay, without contaminating the inner package. So, be careful not spilling the inner contents to keep its sterility. Okay, now grasp the inner package and place it in a clean, dry, flat surface, because any moisture on the surface could contaminate the gloves. And we must keep in mind that the surface must be at waist level, because any object held below the waist is considered contaminated. Okay, now we're gonna open the inner wrapper. And we're going to identify now the left glove and the right glove, which we can actually see here in the inner package as we open it. Okay, now I have seen which is the left glove and the right glove. Okay, I think we're good now to open the inner package to expose our sterile gloves, of course. Okay, carefully opening it. Make sure that we don't touch beyond the 2 inches. Okay, beyond the 2 inches boundary here to keep its sterility. And for easier application, put the first glove on the dominant hand, or we're gonna glove the dominant hand first. So as for me, since I am right-handed, so I will be gloving my right hand first. So by doing that, I'm gonna grasp the glove for my dominant hand by the folded cuff edge with the thumb and the first two fingers of my non-dominant hand. So we're gonna grasp the glove, inserting our okay, now that we have gloved my dominant hand, so next we're gonna glove the non-dominant hand. So by doing that, we're gonna slip or insert the gloved fingers into the cuff of the second glove. So we're gonna insert our glove fingers. We're doing this to avoid contact or avoid touching the exposed part of the second glove, because that exposed part is not sterile. Okay, now I'm gonna insert my hand. Okay, now that both of my hands are gloved, so now I can adjust each glove so that it fits smoothly. Okay, now that the gloves are all good, then we can now interlock the gloved hands like this, keeping it at least 6 inches away from my clothing, and keeping the hands above waist level and below the shoulders. This prevents accidental touching to any non-sterile objects and from my uniform. Okay, now to remove the gloves, I am going to first remove the glove of my dominant hand by grasping the glove here in the palm area or in the cuff area. So either way can do. Okay, like this. Removing carefully. Okay. Okay. Now, in removing the glove of my non-dominant hand, we're going to slip fingers and like this, and we're going to discard this in the proper receptacle right away. And the packaging as well, okay, on the designated receptacle. Okay, and that is my return demonstration of open gloving.
Yeah.